Before we begin our presentation, we would like to acknowledge the Sinaiaks, the Seals, the Tanaha, and the Secwepemc peoples, on whose traditional territories we are grateful to reside and learn. They are, and always have been, the stewards of this land, and we offer our deep respect and gratitude for that.
Psychoanalysis was developed by Sigmund Freud. Freud was born on May 6, 1856, in the village of Freiburg, Bavaria, a small town at the time in Austria and now a part of Czechoslovakia. Before pursuing a career in medicine, Freud studied law. Instead of a law degree, Freud earned his medical degree from the University of Vienna and practiced at Vienna's General Hospital, where he focused on organic diseases of the nervous system. Eventually, Freud came to realize conducting medical research to be too restrictive and faced discrimination for his religious beliefs. As a result of Freud's struggles in the medical field, he supported his family through his private practice in psychiatry, where his psychoanalytic theory would eventually be developed. Sigmund Freud emphasized human behavior as motivated by biological drives or instincts. A primary assumption of psychoanalytic theory is the unconscious mind governs behavior to a greater degree than most people suspect. Sigmund Freud's theory can be viewed in terms of different levels in the human mind, which he described as the scaffold of the mind. Freud divided the mind into three components. The id, it acts as the driving force of personality, the ego that operates on the preconscious and the unconscious, and the superego, which is the social controller that prescribes most normal behavior. Freud's psychoanalytic goal is to make the unconscious conscious. Sigmund Freud's daughter, Anna Freud, applied psychoanalysis to the treatment of children. She also further developed the concept of ego defense mechanisms, delineating 10 and pointing out that these mechanisms can be used adaptively and maladaptively. Anna's list of ego defense mechanisms include projection, repression, regression, intellectualization, denial, rationalization, reaction formation, sublimation, displacement, and introjection. Erik Erikson was a developmental psychologist and psychoanalyst who developed a theory of social development. Erikson's psychosocial stages serve as an alternate model to Freud's psychosexual stages. Freud's theory emphasized basic needs and biological factors, while Erikson's theory uses environmental and social factors. Freud's theory stops measuring human development at 13. Erikson's psychosocial stages look at the development from birth to death. It's worth noting Erikson's wife, Joan Serson Erikson, proposed the 9th stage of development, old age, to take into consideration an individual's increasing life expectancy.
Evolution of psychotherapy. Freud's idea of the unconscious unleashed a whole new school of thought to be studied, the idea of the mind doing things that our conscious selves aren't aware of. This was a block for many later theorists to build off of. Freud's phases were also the beginning of the thought of development theory. Psychoanalysis caused a major shift in how doctors and psychologists viewed treating mental illness. This caused a shift from cruel medical treatments to the idea of talk therapy to alleviate unwanted behaviors, such as hysteria. Psychoanalysis was the first cell in the evolution of psychotherapy. There are still people practicing free association to this very day. What came before? Before psychoanalysis, the original schools of psychology followed Wilhelm Wundt and Titchener in structuralism. Its main purpose was to uncover the structure of the mind through introspection as people reported their feelings and sensations to the observer. After structuralism, functionalism emerged. Going off of Darwin's theory of evolution, William James used functionalism to describe human consciousness and behavior. Stating that both are adaptive, humans use their past experiences to adjust to their present and prepare for their future. Influences on human services. While psychotherapy has moved away from many of Freud's theories, many pieces of psychoanalytic theory remain and have been expanded upon. Many long-term intensive therapies are still used by clients today, with the focus being on happenings in the unconscious mind. Focusing on occurrences from early childhood and how those can present in adulthood. Freud brought forth the development of the therapeutic relationship by having clients come for sessions often, over many years. The idea of talk therapy started with psychoanalysis, with the therapist being objective and not interrupting, while the client talks about whatever comes to their mind, and the therapist interjecting from time to time. Freud started the therapy fad, and it's still going strong today, though it has evolved. Today we see these methods carried forth in how human service workers interact with clients, such as gathering a client's history to be informed of any trauma they may have experienced. Clients are usually screened before the therapy process begins to see if they will be a good fit. The beginning sessions are mainly about building a strong and stable therapeutic relationship. Clients are encouraged to talk about their feelings, while the therapist or helper remains non-judgmental. Psychoanalysis compared to feminist therapy. Psychoanalysis and feminist therapy are on opposite ends of the spectrum in pretty much all aspects. While feminist therapy points out that psychotherapy is a white male-dominated field, with most theories coming from white males, Freud just happened to be a white male who created the first force in psychotherapy theories. Freud offered sessions over long periods of time, years, to select few who could afford such things, mainly white males. Feminist therapy considers the socio-economic status, cultural, and political influences of its clients. In psychoanalysis, women were believed to become neurotic or hysterical because of their penis envy that was unresolved in childhood, and that they compensated for that with childbirth. Feminist therapy believes that women often give away their power in relationships and are forced to live oppressed by male privilege. Freud believed that sexual identity issues and homosexuality were caused by a person becoming fixated in the phallic phase. Feminism offers that women who didn't fit with society's gender roles were often misdiagnosed because of patriarchal therapy practices. While Freud was busy with the unconscious, past experiences and conflicts within the personality and their effect on clients' behavior, feminist therapy focuses on psychological and sociological factors and how those affect mental health. Psychoanalysis consists of one client and one therapist, while the client speaks using free association or relays a dream, the therapist analyzes. Feminist therapy approaches such as consciousness raising, where a group of women analyze their experiences together, creating empowerment to battle against oppression. Finally, in psychoanalysis, only the therapist can analyze and find what unresolved issues are being presented, and then lead towards resolving them. Feminist therapy, the client-therapist relationship goal is to equalize power and to teach the client to understand themselves better, and to also understand the counseling process and be a part of it. Psychoanalysis compared to behavior therapy. While psychoanalysis was the first school of thought in psychotherapy, behavioral therapy followed soon after, stating that psychology should be based on observable behaviors, not introspection. While Freud believed that behavior was caused by past influences and conflict between the instinctual drives of his clients, behavior theorists such as Watson and Skinner believed that behavior occurs through learning and that people are conditioned one way or another in expressing their behaviors. Freud believed mental illness was caused by conflicts between a person's personality structures, the id, ego, and superego, as a person's unresolved childhood conflicts relating to their psychosexual phases. Behaviorism believes that mental illness is caused through learned behaviors, and that if the behaviors are unhealthy or troublesome, that they lead to the symptoms that cause the disorder. The goal of psychoanalysis is to gain insight and interpret what event from the past and conflict in the unconscious is causing distress for the client. The therapist listens and interprets meaning for the client. The goal of behavioral therapy is to teach the client how to change the behavior in order to create more positive behaviors. In behavioral therapy, the client sets clear and concise goals, and the therapist helps support the client in reaching them. Freud gained his insight through interpreting what the client was struggling with through methods such as free association, dream analysis, slips of the tongue, and analysis of transference. All these methods were interpreted by the therapist and are considered subjective. While psychoanalysis is a long, drawn-out process where the client and analyst finally agree that the conflicts within the unconscious of the client have been remedied, and the personality is now restructured so the client can live a happy life. Behavioral therapy starts with identifying the problem, goal setting, and taking action into conditioning new behaviors, with the clients taking the driver's seat in making the changes.
Strengths and benefits of the theory. Freud's psychoanalytic theory helped individuals dive deep into their own psyche and understand what underlies their behavior, which many therapists find his techniques useful. The nature of psychoanalysis is a long, intense treatment that can assist in providing a lot of insight into what drives human behavior. Due to this treatment being long-term, it has shown to provide the individual with long-term positive effects. The psychoanalytic theory insists individuals to bring their traumatic memories into awareness, which can cause a lot of distress. Once these painful memories come close to the conscious surface, the patient typically gets more anxious, as the conscious mind tries to repress these horrible feelings. However, once these memories reach awareness, the patient then is able to repress them. This theory helps clients become understanding and aware of their own feelings. Awareness is necessary for change. Freud's psychoanalysis can be very effective with people who suffer from a wide variety of disorders, including hysteria, narcissism, obsessive compulsive reactions, character disorders, anxiety, phobias, and sexual difficulties. The techniques used in this theory can be much more effective than other medical treatments. This theory offers a guide that helps individuals learn life skills that they can apply in their day-to-day life. Psychoanalysis has grown and developed through the years, which now there are modified versions of psychoanalysis that can fit each individual needs. Weaknesses and limitations of the theory. Psychoanalysis has been criticized, and many therapists choose not to integrate any of Freud's approaches. Freud's theory of psychoanalysis fails to view individual differences in patients. Every person is different. Using the same approaches of psychoanalysis for everyone is not an effective way of treating mental illnesses. That being said, psychoanalysis is largely based on exploring a person's childhood and the repressed memories from that time on. It may not be the case for most people, and the issues that individuals face may not stem from their childhood, which would not make psychoanalysis a good fit for them. This theory does not seem to be adaptable to working with the older population and can be only useful with working with children. This theory decontextualizes individual development. It focuses on the individual as the problem while ignoring wider social problems. Furthermore, this theory doesn't acknowledge the power of labeling and stereotyping that happens in school systems. Another limitation of psychoanalysis theory is Freud overemphasized sex. Freud had controversial views on women and believed that women's lives were dominated by sexual reproductive functions. To Freud, women were just men without penises. His theory was poorly based on a model where there was no place for femininity unless it was linked directly to masculinity.
Free association allows clients to say anything and everything that comes to mind, regardless of how silly, painful, or meaningless it seems. The idea behind free association is when an individual stops censoring themselves and allows dialogue to come about unscripted, the analyst can have a better understanding to what lies beneath in the unconscious. Dream analysis is what Freud called the pathway to the unconscious. According to Freud, in dreams, the ego relinquishes control over the unconscious content. Freud believed dreams to have two levels of content: the manifest content and the latent content. Manifest content is the surface layer of a dream and describes what happens during. The latent content is what underlies the manifest content and contains deeper hidden symbolic meaning. The psychoanalyst uses both layers in dream analysis in an attempt to help the patient discover the meaning of their dreams. Analysis of resistance. During therapy, resistance is the client's reluctance to bring to the surface of awareness unconscious material that has been repressed. Psychoanalysts view clients' resistance as an opportunity to gain insight into the client's defense mechanisms. A psychoanalyst can use the client's resistance to help them become aware of their tendency to use the tactics and may be able to leverage that awareness to help them feel less threatened and more able to let their defenses down. Analysis of transference involves a therapist interpreting distorted displacements of significant relationships clients experience during their transference onto the therapist. Then the therapist interprets clients' buried feelings, traumatic conflicts, and unconscious fixations of early childhood. Analysis of transference helps clients gain insight into the influence of their past on their present.
Okay, Gertrude, today we are going to try a technique called free association. In free association, I will give you a word and I want you to tell me the first word that comes to your mind. It is very important that you do not censor yourself so that we can get to the root of the issues. Do you think you can do that?
Yes, doctor.
Okay, then we will proceed. What comes to your mind when I say boy?
School.
And what about man?
Anger.
Son?
Toys.
Husband?
Mess.
Boss?
Work.
God?
Church.
House?
Mess.
Dishes?
Rage.
Chores?
Pain.
Childbirth?
More pain.
Sadness?
Happiness.
Anger?
Men.
Gertrude, it appears to be just as I suspected. You appear to be suffering from female hysteria. Now, there are procedures such as hydrotherapy or electric shock therapy that we could use, but I think it's best that we consult your husband on the matter, because he will know best.
Well, I think that is just your opinion, doctor.
Theory's consideration of diverse and multicultural perspectives. Psychoanalytic theory has been criticized as not effective for anyone not coming from a verbal middle-class background. This theory works best with upper-class men with a substantial income, as cost and affordability is a major limitation. Individuals from an ethnic minority background or children who experience livelihood difficulties would undergo a punishing time during psychoanalytic therapy, compared to children who encounter feelings deep down, as psychoanalytic therapy is a client-centered and it involves working one-on-one. Multiculturalists state that psychoanalytic therapy is insufficient because it doesn't deal with present concerns or issues with social justice. Freud's theory tends to focus more on the individual rather than their family dynamic or the elements of one's environment. The influences of psychoanalytic concepts in different diverse cultures are pervasive across many parts of the world. Individuals witness these influences in a standard day-to-day life when statements are brought up about the unconscious, Freudian slips, or defense mechanisms. The everyday use of psychoanalytic approaches is not associated with the interconnected nature of social categorizations, such as race, gender, culture, sexual identity, social class, and disability. Freud's emphasis on psychosexual stage is, which has been criticized as it only applies to some cultures, mainly those that are Eurocentric viewpoint. Feminist theories continue to highlight individuals' approaches in therapy, as opposed to viewing women in society. The psychoanalytic theory maintains forms of patriarchy and male domination that are harmful to a woman's well-being. Individuals are faced with realities and communities that are far more complex than what is described in existing psychological frameworks.